Hey everyone, in this video I will discuss the questions from dental anatomy that were asked in NEET MDS 2022. So let's go to the first question. According to Wien's classification of root canal anatomy, type 2 represents option A, 1 orifice and 1 foramina, B, 2 orifice and 1 foramina, option C, 2 orifice and 2 foramina, option D, 1 orifice and 2 foramina. The correct answer of this question is option B, that is 2 orifice and 1 foramina. The Wien's classification has 4 types. In type 1, the root canal starts at a single orifice and travels to the apex and ends in a single foramen. So there is a single root canal from pulp chamber to the apex. In type 2, 2 root canals start at 2 orifices, but they unite to form a single canal before they end at the apex in a single foramen. So there are 2 root canals when they start at pulp chamber, but they end at the apex in a single root canal. So that this is our answer, type 2. So in both type 1 and type 2, there is a single foramen at the apex. In type 3, 2 root canals start at 2 orifices and end at the apex as 2 separate foramen. So there are 2 root canals throughout. In type 4, root canals begin in a single orifice but divides into 2 canals before ending at the apex in 2 separate foramen. So there is a single root canal when it starts from the pulp chamber, but this root canal ends at the apex into 2 canals. So here you will see that in both type 3 and type 4 we have 2 apical foramen. Let's now go to the second question. Mesial marginal developmental groove is present in which of the following teeth? Option A, maxillary first premolar, maxillary second premolar, mandibular first premolar, and option D, mandibular second premolar. The correct answer is option A, that is maxillary first premolar. Let me now tell you a few important points related to the grooves that are seen on premolars. The maxillary first premolar shows mesial marginal developmental groove and it extends to the mesial crown depression. So the mesial marginal groove starts at the mesial marginal ridge, extends downwards into the mesial crown depression, and from there it further extends on the root into the mesial root depression. The central groove on maxillary first premolar is longer than the central groove on any other premolar. Maxillary second premolar has most number of supplementary grooves, because of which its occlusal surface is often described as wrinkled. So if someone asks you which premolar has a wrinkled occlusal surface, the answer would be maxillary second premolar. The mandibular first premolar has a mesolingual groove, and this mesolingual groove is seen on the mesial marginal ridge. The mandibular second premolar has 3 different patterns of central groove, and these are H-shaped, U-shaped and Y-shaped. If the mandibular second premolar has just 2 cusps, then the central groove would be either H or U-shaped. But if this tooth has 3 cusps, then the central groove will be of Y shape. Let's go to the third question now. In the tooth shown, the width of the crown in comparison to its length is. Options are 60%, 70%, 80% and 90%. So to solve this question, we should first identify the tooth. And the tooth in this picture is maxillary permanent central incisor. Look at the form of the tooth and you would know that this is the maxillary permanent central incisor. And according to Wheeler, the length of the crown of a maxillary central incisor is 10.5 mm, while its width is 8.5 millimeters. So if we take the ratio of width to the length of this crown, it would be 81%. So the correct answer of this question is option C, that is 80%. Let's now go to the next question. Question number 4. Mesolingual developmental groove is seen in. Now, since we have already discussed about mesolingual developmental groove, I hope you already know the answer. Still, let's see the options. Option A, maxillary first premolar, maxillary second premolar, mandibular first premolar and mandibular second premolar. The answer to this question is option C, that is mandibular first premolar. As we have already discussed, the mesolingual groove is present on the mesial marginal ridge of mandibular first premolar. Let's now go to the next question, that is question number 5. During reconstructive identification, permanent maxillary second molars are widely used. Which of the following cusps is primitive and smallest? Option A, mesiopalatal, mesiobuccal, distobuccal, and option D, distopalatal. The correct answer here is option D, that is distopalatal cusp. Let's here also see the sequence of cusp size in different maxillary molars. In first molar, the largest cusp is mesiopalatal, followed by mesiobuccal, then distopalatal, then distobuccal, and the smallest cusp is cusp of Carabelli. But if we exclude this cusp of Carabelli, then the smallest cusp in the first molar would be distobuccal. In the second molar, the largest cusp is mesiopalatal, followed by mesiobuccal, then distobuccal, and the smallest here is distopalatal. So in first molar, distobuccal was the smallest, excluding cusp of Carabelli. In second molar, distopalatal is smaller, and in third molar, the largest is palatal, followed by mesiobuccal, and the smallest is distobuccal. So what we notice here is that in the first molar, it was the distobuccal cusp that was smallest. In second molar, distopalatal cusp was smallest, and in third molar, the distopalatal cusp was absent. Now this is because the distopalatal cusp is the secondary cusp in terms of development, while the remaining three cusps, that is mesiobuccal, distobuccal and mesiopalatal, are primary cusps, and therefore the size of distopalatal cusp decreases from first to third molar more than the remaining cusps. What it means is, since it is the secondary cusp, the reduction in the size of distopalatal cusp is more as we move from first to third molar as compared to the other cusps. So obviously all the cusps are reducing in size from first to third molar, but this reduction in size is more in distopalatal cusp, and that is why though it is larger in first molar as compared to distobuccal, it is smaller in second molar, and hence the answer. Let's now go to the sixth question. Which of the following teeth appears primitive and does not resemble any other tooth? Option A, maxillary third molar, then mandibular primary first molar, maxillary primary first molar and maxillary permanent first molar. The correct answer is option B, that is mandibular primary first molar. The mandibular primary first molar does not resemble any of the other teeth, be it deciduous or permanent. Now, because it varies so much from all the other teeth, it appears strange and primitive. Let's now go to the last question. Question number 7. Identify the structure marked by the arrow. Option A, sigmoid notch, mesenteric notch, maxillary notch and glenoid notch. The correct answer is option A, that is sigmoid notch. The sigmoid notch is also called the mandibular or the semilunar notch, and it is located between coronoid and condylar processes. Also, one part of the lateral pterygoid muscle attaches to the front of the neck of this condyloid process. In a depression that is called the pterygoid fovea. So there is a depression just beneath the condyle, and this depression is called pterygoid fovea, and in this pterygoid fovea, lateral pterygoid muscle gets a attachment. So that's all for now. I will see you soon with more questions from NEET MDS 2022. Hope this video was helpful. Thank you.